My sessions right now,
Okay.
my knee pain is very minimal. To say that I do not have daily pain anymore, I think that's a testament of itself. So, yeah, I'm very, very grateful that I chose empowerment physical therapy. Well, I'm Leanna Foster. I'm a registered nurse. I work in a school as a school nurse right now. I'm also a mom of two. And I came here due to having a knee pain that I guess you could consider chronic, um, which started. I recently had my son. He's 1 years old now. And after having him postpartum, I decided to get back into exercising. Um, and I do think that that's a part of the cause of me going a little too fast or, too intense with my workouts before I was quite ready for it. But I developed this knee pain that I had for several months. And it got worse and worse. So I did go to my primary doctor about it in September. And unfortunately, he wasn't very helpful. And just kind of told me I should try to lose some weight, that maybe it was the stress on my joints. And so that made me work out more, which is probably not the best thing to do. So I got to a point where I woke up one morning and I could really not put much weight on my left, which is where the knee pain is. So I went to urgent care. They did a bunch of x-rays. They noticed that there was something off, misalignment in the x-ray. So they referred me to an orthopedic doctor who diagnosed me with patellofemoral syndrome, which
Yeah.
they said is known as runner's knee. Um, and so I basically needed to strengthen my quads before I could have gotten into all those intense exercises that I was doing before. So they recommended that I go to physical therapy for an evaluation. They gave me a list of um, locations. And honestly, I picked empowerment therapy initially because I like the name. I called and the front desk person, Kyle, was very, very informative and kind of just made it feel like very welcoming um, and knowledgeable with like a step by step of what would happen next. So I came in and I met with you, Dr. Lynn, and I was actually really blown away with your initial evaluation. But the evaluation you did seemed very thorough to me. You did way more than my doctor did. Laying me down, looking at my knee, looking at its alignment, assessing my mobility a little bit before you even saw me as a patient, and then outlining um, a plan of attack and of how we would go about helping me to strengthen my legs. And so, honestly, after that, yep, this is where I'm going to go. You felt very knowledgeable. I felt very welcomed here, and I still do. And I've been maybe about halfway through my sessions right now.
Okay.
My knee pain is very minimal. One concern I had as having kids and a 1 year old especially is just being able to get down on the ground and play with him.
Yeah.
And I am able to do that now. So that has been wonderful, just being able to be a bit more active with my kids, even at work, not having to work through pain all day has been amazing. Um, and I feel like I'm getting stronger. They're adding weights to my workouts here, and I've started to reintroduce some workouts at home as well,
Yes.
being mindful of my pace and intensity, and no pain at home with doing my workouts at home. Um, you guys provided me with like the exercise bands to take home and a nice little workout programming that I could repeat at home as well. And so it's been very holistic, very helpful. I'm very impressed with the improvement my knee has made because I was in pain for months. And for it to be 1 month in, to say that I do not have daily pain anymore, I think that's a testament of itself. So, yeah, I'm very, very grateful that I chose empowerment physical therapy.
Given that this is obviously a chronic issue that was going on for a couple of months, could you walk us back through, emotionally, what was that like for you?
Emotionally, honestly, it was discouraging because these were workouts that I could do prior to pregnancy. And so I kind of went back to what I used to do. And it felt very discouraging, feeling like my body could not participate in those movements like they used to. It also it made me feel old. I'm in my 30s and made me feel like, why do I got creaky joints? Why are my knees hurting? It made me feel really old. And I don't want to feel old. I have young kids. I'm young, got a lot of life left to live. And so, um, Emotionally, I think that was the biggest thing. It just kind of made me feel old because a lot of the time you're kind of told, oh, you're getting older. So, you know,
Uh,
you're going to have aches and pains and you kind of live with it or you think it's normal to live with it. And it doesn't have to be the norm. Pain is not normal. You should not live with it. You should try to fix it in any way you can. So, um, I think at first I thought it was normal. So I just kept going, thinking it would go away.
Right.
And then when I hit a wall and I could not go any further. So, um, yeah, it was very sad at first.
How does it feel? What's life like for you now?
Oh, I mean, it feels great. Now not having pain. Now I can get up. I can run around behind my kids. I can pick up after them, clean up off the toys off the floor. I can live my daily life more fully. Now that I'm not in pain every day. With the knee. So just a fuller lived life is where I'm at a month later here.
Would you say, is that investment worth it?
The investment is definitely worth it. Um, I am also a person that thinks that any investment in yourself and your health is worth it. I'm a nurse, so um, definitely worth it. Do not struggle. Do not live in pain. There is a better side to it. It may be a little bit expensive for some, depending on your budget, but honestly, the outcome that I've had is definitely worth it. 100%. And Dr. M, who I've been working with, has been amazing, so knowledgeable, introducing things that I never even thought of, like cupping and explaining which muscles we're working on. Just, I know what a glute med is now. I didn't know what that was before. But now I definitely know what it is. And so it's been a learning. You learn a lot about your body, you learn about your limitations. And I've been able to learn more about gradually increasing movement and the importance of that.
What would you tell someone who's probably at a similar headspace as you are, skeptical, nervous, have lived with this for quite some time, and have been told by doctors that I should just sit on this and it's
Yeah.
age, it's weight?
I would tell them you got to advocate for yourself. I mean, it's very hard these days, doctors telling you one thing and you telling them, no, this does not feel good. Something is wrong in my body. And they're telling you to wait it out. It will get better, but not actually providing you a solution. Do not accept that. Advocate for yourself. If your primary is not going to do it, seek out a specialist in that area, whatever's bothering you, and find a place that you feel welcomed and you feel actually has the tools to help you. You have to advocate for yourself. I think that's the biggest part. And the biggest thing I've learned is that my doctor did not advocate for me. He did not point me in the right direction. And it wasn't until I hit the wall that I got led into the right place. And I didn't have to hit the wall.
How did you found us?
They gave me a list of physical therapies in the area, and I picked you because of the name, Empowerment Physical Therapy, as well as location. You're very close to my home. It's like a 5 minute drive from my home, and so that's pretty much why I picked you. So, like I said, very welcoming and very knowledgeable on the phone as well with how the process would go, as well as with like insurance. You guys were really good about checking the insurance for me and what would be covered, what the deductibles are, giving me all of that information.
What do you think the life, knowing now, knowing what you know now and knowing how you feel, what do you think life would look like if you didn't come to see us?
Oh, I mean, I would be out of work, missing work, a lot of work just because I've had knee pain. Um, I would be struggling every day just to be with my kids. They'd want to go outside, play in the snow, and I would be like, no, I can't because my knee is hurting. Or they want to crawl around on the floor, and I'd be like, no. Even when I did have the knee pain, them just bouncing around on my bed, and they might have hit my knee a little wrong. Oh my God, it was like the end of the world, like that pain. And they think they did something wrong, and they're not. They're just being kids. Um, and so I think that it's you don't need to live in pain. It affects not only you, but the people around you. It affected my kids for sure. I wasn't able to show up as the mom that I would want to show up as. Um, so yeah, you don't need to live like that. You should not accept it.
And speaking of showing up, I think you kind of alluded to how has that impact other aspects of your road at home, at work?
Yeah, so at work, I'm a school nurse, so oftentimes I have to run to a classroom to help a kid if they're not feeling well or what have you. And so I'm definitely better able to move around the building, more so than I was before. I was kind of hobbling along beforehand, which was probably making things worse. But I was hobbling along, rushing. Um, at home, like we said, just kind of better communication with my kids, better time spent with my kids. Also with my husband, easier for intimacy and hanging out and things like that. Um, and so it's definitely a 180. So now I'm able to do a lot more. You don't need to live in pain. Advocate for yourself, and I definitely recommend empowerment physical therapy as the place to do that. It's like a home away from home. Everybody's so friendly here. We get the job done, but it's also very, very personable. They ask me how my kids are, how Christmas was, all of that. And so it's a very nice place to be, and I would definitely recommend empowerment to anyone. I actually love that it's time for me. I don't really get a lot of time just for me. This is time just for me and to focus on myself. It's structured. We have our program and I know what to expect and what we're going to do, even though we might be a little bit more intense or more weights or whatever. Um, I know what to expect. So I like that the plan has been laid out for me and it's not just kind of haphazard. We are increasing reps or we're increasing weight. So that makes me feel I am stronger because I'm able to do those things. So there's always like improvement every time I come. There's like a little bit more of an improvement. And you can kind of see that very easily.
You mentioned going back to dancing. How's that?
Oh yeah. So I had my Christmas party a couple weeks ago.
Yeah.
My work Christmas party and I was dancing. I was in a little bit of pain the next day. I won't say I wasn't. But during I was doing my thing. I could not have danced a month ago. I was definitely dancing, had a little bit of soreness the next day, but I iced it the way that you guys have told me,
Yeah.
and did the stretches the way that you guys told me. And after a day, that soreness was gone.
Lovely.
So yeah, I didn't need to take any medicine or anything like that. It went away on its own.
Thank you. Thank you.
No problem.